In general, الانتيهلمنتيك أو الهلمنتيك ممكن تتقسم إلى three kinds, like nematodes, trematode,s and cystoids. Are three major groups of helminthics and that infect a human. Most antihelminthic target elimination the organism from the host rather than killing it, as well as controlling the spread of the infection. فبصورة عامة إنه نحن نركز على eradication of the parasite rather than totally eradicate it or totally kill it. فنحن حنقسم أيضا حنقسم الانتيهلمنتيك إلى عدة أقسام اللي هي drug for the treatment of nematodes. النيماتويد مثل عندنا Onchocerciasis, the causative organism Onchocerca valvalis, is common in a tropical area like Africa, Brazil, Venezuela, Yemen, which characterized by subcutaneous nodules, pruritic skin rash, and ocular lesion, often resulting in blindness. التريتمنت هو الإيفرمكتين. راح نبدأ نحكي عن like every agent separately. طبعا عندنا البين worms disease أو enterobiasis caused organism is Enterobius vermicularis, and most common helminthic infection in the United States. حقيقة ما بس باليونايتد ستيت، يعني طبعا عندنا مشكلة نحن بالعراق إنه ما عندنا دراسات إحصائية بالنسبة لهذا النوع من الانفكشن. But in fact it's very common. It's really common infection. It can cause pruritus and occurs with white worm visible in the stool and perianal region. عادة التريتمنت هو ميبندازول والبيرينيتال فامويت. هذول مع انه خلينا نقول medical intervention او pharmacological intervention effective، لكن دائما الكومبلاينس انه recurrence of this kind of infection، ما لانه التريتمنت ما effective، لكن الري-infection incidence is too high. يعني اهم شغله نحن لما نحكي مع المريض لما ننطي هاي انواع من العلاجات، انه يتاكد انه ما لازم يصير هذا انه يرجع ينعدي مره ثانيه، عن طريق انه لازم تنقص الاظافير، تنغسل من تحت كلش مريح، يحاول انه قبل الاكل لازم يغسل يدينه دائما ويتاكد انه الاكل ماله نظيف. اضافه الى ذلك عندنا الاسكرياسيس او راوند وورم ديزيز. The causative organism Ascaris lumbricoides. Globally, the most common human worm infection ingested larvae grow in the intestine and cause abdominal symptoms including intestinal obstruction, roundworm, and may pass to the blood and infect the lung. The drug of choice albendazole, mebendazole, and parental pamoate. Filariasis, the causative organism Eucheria pancreatis, and the worm can block the lymph flow and ultimately local inflammation and fibrosis of lymphatic occurs. After use of an infestation, the arm and leg and scrotum fill with the fluid causing elephantiasis. Therapy عادة combination of diethyl carbamazine and albendazole. Trichuriasis or whiteworm disease, cause of organism trichuria, and infection is usually asymptomatic. However, abdominal pain and diarrhea and flatulence can occur. Therapy, drug of choice will be mebendazole. Hookworm disease, cause of organism Ankylostoma duodenale, old world hookworm, or nectar americanus. the New World hookworm. The worm attacked the intestinal mucosa and causing anorexia, ulcer-like symptoms, and chronic intestinal blood loss that lead to anemia. Treatment is unnecessary in asymptomatic individuals who are not anemic. Therapy, parental pamoate, and mebendazole. Lidiasis, threadworm disease, causative organism, Syndronguloides styrocoralis, and relatively uncommon with compared with intestinal nematodes, relatively benign. It's normal individual that can progress to fatal outcome in immune compromised patient. فإذا ما كان immune compromised, there is no need for intervention. The drug of choice for treatment of this situation is ivermectin. Trichinosis caused by organism Trichinella spiralis, usually caused by consumption of insufficiently cooked meat, especially pork. Started with abdominal discomfort followed by muscle pain and swelling of face and eyes and itching joints. الثيرابي عادة أو الدرج of choice هي albendazole or mebendazole. نبدأ نحكي عن pharmacological agents. مثلا الميبندازول هو synthetic benzimidazole compound, first line for treatment of several helminths like whipworm, pinworms, hookworms, and angiostoma, in addition to roundworm, Ascaris limbricoides. كميكانيزم اوف اكشن اللي اريده من عندكم انه فقط تعرف انه bind to parasite beta tubulin and inhibit microtubule polymerization. فلهذا multiplication of the worm is inhibited and causing paralysis for the parasite. The affected parasites are expelled in the feces, فممكن فلما تعمل له paralysis فممكن انه هذا يعبر خارج عن طريق defecation. The adverse effect can cause abdominal pain, diarrhea. Mebendazole should not be used in pregnant women. That can cause teratogenicity. Parental pamoate is also effective in the treatment of infections caused by roundworm, pinworm, and hookworms. And parental pamoate is poorly absorbed after oral administration and is only effective against intestinal infections. Parental حقيقة can cause depolarizing and neuromuscular blocking agent and cause the release of acetylcholine and inhibition of cholinesterase leading to paralysis of the worm and subsequent expulsion. السؤال هو إذا كان parental طعنانه intravenously ايش تتوقع انه راح يصير؟ من الواضح هو انه هذا كولينستريز انهبيتور. لكن خلينا نقول الفائده مالته انه ما يصير له ابزوربشن. فهي طعنانه سيستميكلي اللي راح يصير كالتالي. اللي راح يصير انه راح يزيد الاسيتايلكولين وراح يصير عندنا severe stimulation of parasympathetic sympathetic system which cause like مثل ما هو موجود عندنا النوزيا, diarrhea, hallucination, and the most serious is the paralysis and suffocation due to paralysis of diaphragm muscle واللي هي عادة voluntary muscle paralysis. thiabendazole حقيقة withdrawal from several countries due to its toxicity. الأفضل أتوقع يعني ماكو داعي ناخذه هسه. آه، بالنسبة للثيابندازول أنتم ما مطالبين بيه. الإبرمكتين is very important. حقيقة الإبرمكتين جت فترة إذا تتذكرون إنه صار من ضمن الجايد لاين أوف تريتمنت أوف كوفيد 19 نتيجة الاميونومodulatory effect of ivermectin. So it is the drug of choice for treatment of cutaneous larva, migraines, strongyloidiasis, and onchocerciasis, اللي هي من river blindness, and although it's not curative due to lack of activity in adult worm, ivermectin get the glutamate gated chloride channel receptor and causing the chloride influx enhanced, so it causes inhibition or kind of hyperpolarization occur, resulting in paralysis and death of the worm. Usually is given orally and does not readily cross the blood-brain barrier. Ivermectin should not be used again in a pregnancy. Killing of the microfilaria of onchocerciasis can result in dangerous Mazotti reaction, اللي هو including fever, headache, dizziness, somnolence, and hypotension. The severity of this reaction is related to the parasite load. فمعناتها ايش قد يكون الانفكشن severe infection، ايش قد يكون الرياكشن يكون very severe. فعادة الانتيهستامين and steroid may be given to ameliorate these symptoms، لأن هاي عبارة عن خلينا نقول immune reaction نتيجة ال presence of foreign body in our tissue. فلما يصير lysis لهاي الباراسايتس تبدأ تتحرر اللايسوزومز، تتحرر كثير من البروتينات اللي stimulate our immune system. Diethylcarbamazine is the drug of choice for filariasis and caused by infection with the Eukaryoria Bancrophyti, Oprogia malaya, and it kills the microfilaria and have activity against adult worm. كملاحظة in countries where filariasis is endemic, the combination of antifilarial drug like diethylcarbamazine and albendazole or ivermectin and albendazole may be used annually as a preventive chemotherapy. فالمكان اللي عادة endemic من فترة وفترة ترجع لهم، فعادة ينطوهم as a prophylaxis combination. Diethylcarbamazine is rapidly absorbed following oral administration with meal and excreted mainly in urine. Adverse effects: fever, nausea, vomiting, and arthralgia. In addition, it can cause headache. هاي هتطلع على النيماتويد. بالمناسبة هتلاحظون إنه أكو أدوية ممكن تشتغل على النيماتويد وترايماتويد، فأكو نوع من خلينا نقول من الأوفرلابينج. فعندنا مثلا أنواع الانفكشن الباراجنومياسيس caused by organism Paragnomiasis westermani أو lung fluke. The organism move from GIT tract to the lung, which is primary site of damage. Secondary bacterial infection can result in cough with the product of bloody sputum. The disease is transmitted by eating raw or uncooked crabs. It's really very common in our country. Paragnomiasis is diagnosed by identifying eggs in the sputum and the stool, and the treatment is parasequantia. Clonochiasis causes the organism اللي هو clonoorchiasis senesis or the oriental liver follicles. The primary site of infection is the biliary tract, where the resulting inflammatory response can cause fibrosis and hyperplasia. The disease is transmitted by eating raw, fresh, or water fish. is diagnosed by identifying eggs in the stool. The therapy again is praziquantel. Schistosomiasis causing organism Schistosoma mansoni tracheum. The primary site of infection is the GIT tract, إذا كان new word. The damage to the intestinal walls caused by host inflammatory response to the eggs deposited at the site of infection, and the eggs secrete proteolytic enzyme that further damage the tissue. The clinical presentation عادة تكون GIT bleeding, diarrhea, and liver damage. The disease is transmitted directly by direct skin penetration, and this form of schistosomiasis is diagnosed by identification of characteristic egg in the stool. السchistosomiasis أو الأولد وورد اللي مثل إيجيبت، مثل في بعض الأحيان الفريش ووتر contaminated the fresh water old world. مثلا الكوزيف اورجانيزم في هاي الحالة هو شيستومياسا هيماتوبيوم. The primary site of infection بهاي الحالة هو are the veins of urinary bladder where the organism can induce fibrosis, granulomas, and hematuria. The disease is transmitted by direct skin penetration. معلومة يمكن هذا interesting. عبد الحليم حافظ حقيقة مات بسبب البلهارسيا. And this form of schistosomiasis is diagnosed by identification of characteristic eggs in urine or bladder wall. The therapy هي praziquantel. أيضا فأتوقع إنه معظم العلاج ما يتم praziquantel. Praziquantel is the agent of a treatment of all forms of schistosomiasis and other trematode infection. Cystoid infections such as teniasis. Praziquantel causes contracture and paralysis of parasites by increasing the permeability of cell membrane into the calcium. Once it enhances the calcium entrance, it can cause paralysis to the voluntary muscles of the parasite. The common adverse effect is dizziness, malaria, and headache, as well as gastrointestinal upset. Praziquantel is contraindicated in the treatment of ocular cysticercosis because the destruction of the organism in the eye may be irreversible damage. فنحن بنقتل هذا الأورجانيزم هو موجود بال in ocular system or ocular area. It can cause irreversible damage to the eye. Lastly, the drug for the treatment of cystoids. الإكنيكوكيوسيس أو الهيداتد cyst cause of organism هو إكنيكوكوسيس granulosis اللي هو dog tapeworm. Infection produce large hydatid or cyst in the liver, lung, brain. Actually, it could be anywhere. Anaphylactic reaction to the worm antigen can occur in the cystic ruptures. The diagnosis, the disease follow ingestion of the egg of the dog feces. Sheep often serves as intermediate host. Echinococcus is diagnosed by CT scan and through biopsy of the affected tissue, and it is treated by surgical excision of cyst, and also can given albendazole as treatment. Teniasis causative organism Adultenia solium, or what is called pork tapeworm. Intestine are the primary site of the infection of this kind of parasite, where the organism can cause diarrhea. Most of these infections, however, are asymptomatic. The disease is transmitted by larvae, undercooked pork, or by ingestion of tapeworm eggs. Teniasis is diagnosed by detection of oproglottid in stools and therapy praziquantel. Cystic causes organisms is Teniosodium larva. Uh, Infection produce cysticeriosis in the brain and cause seizure, headache, vomiting, and in the eyes. Uh, Infection can can include ocular ocular site. The disease follow ingestion of the egg from human feces. Cysticercosis is diagnosed can be diagnosed through CT scan or biopsy. A therapy, praziquantel or albendazole, and or surgery. Teniasis causative organism larva from Tinea siganeta of beef tapeworm organism primarily infected the intestine and does not produce cysticeriosis, and most infected individuals are asymptomatic. The disease is transmitted by larvae in undercooked raw beef, and Teniasis is diagnosed by detection of proglutide in the stool. Therapy again, praziquantel. The fish tapeworm, which cause diphtheriasis, and the adult worm in the host intestine can be as long as 15 meter. The disease is transmitted by larvae in the raw or undercooked fish. Diphtheriasis diagnosed by detection of characteristic in egg stool and therapy, praziquantel and niclosamide. Necrophamide is alternative to praziquantel in the treatment of teniasis, diphtheriasis, and other cystoid infection. Niclosamide inhibits mitochondrial phosphorylation of adenyl diphosphate in the parasite and making it lethal for the cystoid scolex and segment, but not for the ova. Laxative is administered prior to the oral administration to purge the bowel of the dead segment and enhance digestion liberation of the ova. Finally, albendazole may be one of the most important antihelminthic. Another benzimidazole inhibits microtubule synthesis and glucose uptake, and is effective against most of nematodes known as a primary therapeutic application. However, it's the treatment of cystoidal infestation such as cysticercosis and hydatid cyst, and caused by larval stage of Echinococcus granulosus. And it is undergo extensive first pass metabolism in the liver, including formation of the active sulfoxide. When it is used in short course, like 1 to 3 days for nematoidal infestation, adverse effect usually is mild, transient, and this include headache and nausea. While the treatment of hydatid disease, which take like 3 months, has a risk of hepatotoxicity and rarely a granulocytosis or pancytopenia. So medical treatment of neurocyticercosis is associated with an inflammatory process to dying parasite in the central nervous system and cause headache, vomiting, fever, and seizure. But this is all about antihelminthic. فهسه ننتقل إلى الأنتي بروتوزوال drugs. Anti protozoal is divided in actually many categories like chemotherapy for amoebiasis, malaria, leishmaniasis, toxoplasmosis, and giardiasis. نبدي بالاميبياسيس. بالنسبة للكيموثيرابي فور اميبياسيس نبدي بالاميبياسيس إذا هذا شوف after ingestion the cyst أو let's see how the infection is begun. After ingestion of the
دكتور
نعم.
الباوربوينت ثابت على القديم
أوكي
ما تغير.
أوكي استغير. شكرا.